Hi, my name is Morgan Krysiak. I am a family nurse practitioner student at Youngstown State University. Please introduce yourself.
Hi, my name is Taylor Hayes, and I'm a psychiatric mental health nurse practitioner.
And go ahead, tell me a little bit about yourself.
So I graduated from Penn State Barron with my bachelor's in 2019. I worked in the ICU for about 2 years, and that was during COVID. I got a little burnt out being in the COVID unit, and I went to endoscopy, and I worked in endoscopy for 4 years. And I chose to go back to school just to have more autonomy. I always knew I wanted to become a nurse practitioner, and it was just the right time for me. So I've always enjoyed psych and talking to people and just helping people feel better. I'm very passionate about empowering people for their mental health, so I just knew that was the right path for me.
Lovely. So go ahead and tell me a little bit about your position as an APRN, including your specialty and all that.
So I specialize in psych, and I have an interesting job because I get to work from home, so it's completely virtual. And I've been doing this since December. I passed my boards, got credentialed, all the stuff. So I get to work from home, pick my own hours. I work Monday to Friday, 7 to 3:30. I really enjoy it. It's been very interesting so far because I'm in charge of doing all of my own coding. I got my LLC because I'm contracted through a company, so I got an LLC, opened a business bank account. So I learned a lot through that, just to own my own company and be independent, but also have prescriptive authority with that as a new nurse practitioner. So I've been learning along the way, but it's been a lot of fun and I really enjoy it so far.
Awesome.
Yeah.
All right, for our next question we have, do you see an APRN's influence in today's healthcare system?
For sure, definitely. Even as a patient myself, trying to get in to see my PCP, I haven't seen my actual primary care physician in years. I see a nurse practitioner. And I really think that nurse practitioners are taking in most of the patient population because there aren't enough providers to go around. So I think nurse practitioners are very needed in today's society. I think they're filling in the gap that providers can't reach. I think that we're very knowledgeable, we're educated. The background of nursing really taught us so much. And so I think we're very needed in today's world.
And what are some of the barriers that then come along with that though?
I think as nurses we always struggle with the work-life balance. As a nurse practitioner, I think it's even more because we're seeing so many patients throughout the day, but then we have to chart on all those patients. So just trying to fill in the time for the work-life balance, as well as we're getting calls on off hours, stuff like that. I think another barrier is not being in a full practice state. So being in Pennsylvania, we have to have 2 physicians on our prescriptive authority license. And so that sometimes is hard to get. Thankfully, the company I work for, they're paying for the providers to be on my license, but also I'm only meeting with these providers. Well, I'm only meeting with the one provider once a month. So it's a lot of money to pay these providers who really aren't practicing with me. I think it's also difficult to find mentorship as a nurse practitioner. As a nurse, as we know, we graduate, we pass the NCLEX, we start our jobs, we have a nurse residency program, we have so much support. Nursing is such a big community. Whereas I feel as nurse practitioners, we're kind of alone, we graduate, and maybe it's because I'm working virtually, but even at the hospital when I was working there, I just felt the nurse practitioners are kind of always alone, on your own. I don't know how much mentorship there is. And then for students, I think that it's really hard to find preceptors sometimes, which can be really challenging, especially to get through school and take extra time.
That leads perfectly into the last question of what changes would you like to see be made for these nurses?
So I would like to see nurse practitioners have full authority in Pennsylvania. I think it's super important. I think it'll fill the gaps It'll be less costly for patients because we aren't getting paid as much as doctors. I think it'll provide more health care to the state, really. I also would like to see like nurse practitioners kind of form their own like community, just like nurses. Sometimes I think there's resistance for nurse practitioners to practice with their full authority, but also alongside the healthcare team, maybe we're not as respected as we should be. I think there's a lot of resistance there, so really, taking a stance and coming together and proving that like we are knowledgeable and we're here to help, and so that's what I'm thinking.
Awesome.
Yeah.
Well, thank you so much for taking the time to answer all my questions. I appreciate you taking time out of your busy life.
Yes, of course.
Appreciate you so much. Thank you.
You're welcome. Good luck with everything.
Thank you. And cut.
Yay. Did we do good?
I think so. I think we nailed it.
Yay.